let's talk about nipple diseases. These are the nipple includes absence of the nipple, supernumerary nipple, nipple retraction, cracked nipple, papilloma of the nipple, retention cyst of a gland of the Montgomery, chancre of the nipple, eczema of the nipple, and package disease of the nipple. Package disease of the nipple. Package disease of the nipple is a superficial manifestation of an underlying breast carcinoma. It presents as an eczema-like condition of the nipple and areola which persists despite local treatment. The nipple is eroded slowly and eventually disappears, and the nipple eczema should be biopsied if there is any doubt about its cause. Microscopically, package disease is characterized by the presence of the large ovate cells with abundant clear pale staining cytoplasm in the malphizian layer of the epidermis. Cause of the nipple discharge. Discharge from the surface due to package disease, skin diseases like the eczema or psoriasis, or rare causes like the chancre. Discharge from a single duct. Broad stain discharge includes intraduct carcinoma, intraduct papilloma, duct ectasia, or serous includes fibrocystic disease, duct ectasia, and carcinoma. Discharge from more than one duct includes broad stain discharge due to carcinoma, ectasia, and fibrocystic disease, grumous due to duct ectasia, purulent due to infection, serous due to fibrocystic disease, duct ectasia, and carcinoma, and milk due to lactation or rare causes like hypothyroidism or pituitary tumor. Investigations include examination of the discharge, ultrasound, mammography, and FNAC. Criteria of the nipple discharge includes broad stain discharge, black or green discharge, serous discharge, and purulent discharge. Treatment of the nipple discharge. Exclude a carcinoma by occult blood test and cytology. There is no blood in the discharge, simple reassurance is sufficient. But if the discharge is proving intolerable, an operation to remove the affected duct or ducts can be performed. Surgical options include microdectomy and cone excision of the major ducts. End of the topic.